I'll start by way of introducing the topic, which is the Telecom Innovations of Public Health Practice. Now, this is a project called VIGIT System. It's a 6-month pilot of the VIGIT system in public health, among public health physicians. It's called Project 2480. For today, our special guest is Dr. Yakubu Adamu. So he will be giving us the opening remarks. Then we can now continue with the presentations. Dr. Yakubu Adamu.
All right, so thank you very much, Dr. Kene, and the Ave Health team. I really want to, first of all, okay, so let me introduce myself first. So my name is Yakubu Adamu. I'm a consultant public health physician and also an entrepreneur. Honestly, I feel very honored to be selected as one of the special guests for week 2 of the series of the webinar on telecom innovations championed by Ave Health Sense in collaboration with the VIGIT Platform International. And honestly, I really want to welcome all of you and thank you for sparing your time, especially on a Sunday evening, to attend this webinar. You know, as they say, knowledge is power. And I really want to assure you that the time that you're going to spend, the 1 hour you're going to spend here will really be worth it. I want to believe that at the end, you will make some decisions that will really affect you positively. I will leave the rest on my experience with the platform, but on this note, I want to declare this meeting open so that we can save time and then we can share experience sharing at the end of this meeting. So on that note, I feel honored to declare this webinar for today open. Over to you, Maeva.
Okay, thank you very much, Dr. Adamu. Thank you very much. I appreciate you. So I'll go straight to the presentation. We don't intend to take much of time. Now, the title is Telecom Innovation for Public Practice. It's a six months pilot of the VIGIT system for public health physicians in Nigeria. It was approved by the ESCO that every state there is a member of the association should be part of this project. And the approach is to have at least 5 people register on the platform and test run what it works and look like. So I'll explain how the platform looks like and how we are deploying it. Well, based on the presentation, 2 of us will make the presentation, myself, Dr. Tefa Ken, the public health physician, and of course, Joshua Tahu, who is the CEO of Vision Platform, who is anchoring the telecom component of the project. So for this project, and the project manager and the principal investigator. Now, telecom innovation for public health practice. I want us to cast our minds back to COVID era. The few years that we had COVID, it was full of uncertainties and nothing was actually happening. And all of us were challenged by so many things, including our practice. But while this was happening, certain technology became very useful to us, especially things like Zoom. Communication became the in thing. There was lockdown, so people were in their homes, so they couldn't travel and things like that. So calls became very important. Social media became very important. And of course, most of us that were running brick and mortar business had issues. So, but one thing that happened was telecom was actually booming at that time. Why? Because communication is important. And these have shown, documents have shown how much it has contributed to the gross domestic product. And of course, this growth has been significantly documented in so many technical reports. Look at $1 trillion worth of business done in 2019, increasing to 2.8. So 2.5 increasing to 2.8. That is huge. Meanwhile, at the same time, other industries were declining. There was a huge growth. It's even said that this contributed to the situation that Nigeria expressed by coming out of recession. So what it simply means is there's so much money circulating with the telecom industry. Now, as public health physicians, we talk about healthcare finance. Now, so much have changed. I was happy when we were talking before we started. We were talking about how telecommunication was before, that you need to go to someone's house to make a call. Today, you can make calls anywhere, which means that so much have changed. Now, the change have equally moved money into the system. Now, imagine a situation where 1% of the funds that are circulating with Telecom is invested in public health. For instance, if we're even taxing USSD code that people use on a daily basis, we're taxing 0.5%. That huge amount of money can be invested in public health. But the challenge is that that money tax goes through a system where it becomes very difficult for that amount to come out of that system to service the industry that we're talking about, the public health and the health industry. So this is evidence of the growth that we have seen in the industry. So much is happening there. MTN has given a lot of huge funds that they made within this period. Look at this. MTN's full year revenue hits 1.7 trillion. Hits, which means it has gone beyond 1.7 trillion at the moment. And this was a report in January. Can we say that much about the industry of public health? No, but we can tap into it and improve what we do. The other telecom industries are equally reporting progress. So the question of it actually asking is, Nigerian telecom industry has huge potential. We've seen evidence. This profit were made due to tools employed by telecom communications. And one of the tools is Zoom. Now, but the truth of the matter is that by the time we're done with 1 hour Zoom here, all of us have expended money. We don't know where this money ends to. Your data has been consumed, but that data gets converted to somebody's cash. So the only challenge is that it is not our cash. It is not your cash. Imagine that whatever we're doing gets into cash that we can use for public health practice. That is the whole idea around this. But on a daily basis, money moves away from us. The banks charges us on almost everything. Insurance gets money from us, but when the issues arise, nobody is willing to compensate. Zoom takes away money. Social media takes both money and time. People are on social media on a daily basis. Telecom takes away time and money. And of course, as we are workers, we are making use of these tools. Now, it has become a normal thing now that you go to work, you have 2-3 Zoom calls, you have 2-3 WhatsApp group chats happening on a daily basis. So this is a question that bothered our mind. In the last 18 months, we've been trying to play around what we know to see that, look, we'll create something that will be beneficial to the public health arena, and by extension, beneficial to public health, to the health system. So the big question that keeps agitating our mind is the fact that, are there innovation financing mechanisms that can be used? Yes, if there are, how can we use them? How can this telecom digital cash flow circulate among public health practitioners to enhance quality of their work? This is the question that kept agitating our mind. And the truth of the matter is, whether you like it or not, when money circulates among a system, the system improves. The telecom will keep improving because money is circulating among this. Now, as we talk today, there are newer products that are amazing. People are talking about phone without SIM cards. So I remember there was a time where buying SIM cards at huge cost. Today, that is no longer the case. So once there's funds circulating among the system, within a system, the system improves. So if we have funds circulating among public offices, we assume that things will happen differently. So this is why Ave Health Sense, in partnership with VIGIT Platform International, has come up with systems that will circulate value and create a source of income while taking care of your expenses, whether they are personal expenses or office expenses. So what is the solution? There are 3 components to this solution. The first component is the design of digital tool for real-time data capturing of key performance indicators. Now, it's important for us to understand that as doctors, there are areas we may not reach now for either security reasons or for reasons of logistics, either from the angle of roads that are being bad. But we can now have digital tools that can capture data in those locations and make it available to us. That we know is possible because of technology. The second component is that, okay, if we have designed all this, what then? How then can we finance this? So the virtual top-up automated telecom trading systems helps us with 1% weekly commission for cost recovery. The third component is advanced COMBOPAK basic for minimum audio telecom system, telehealth system. So this is the three components. I will be talking about them one by one. But as we do that, I plan to do that. I'll call on Joshua to give us the fragments that are coming from the telecom industry that we're putting together to have this within the public health system. So thank you very much. Joshua, if we're on, you can take off from now. Meanwhile,
Yeah, very good evening, everybody.
Yeah, go ahead, Joshua.
Okay, good evening.
Good
Dr.
evening,
can you hear me?
Yes,
okay,
I can
good.
hear you.
Okay, cool. Okay, cool. So my name is Joshua Tahule, as introduced, the CEO of Virgin Platform International. First, Virgin Platform is an entity of itself, which is a registered company, corporate affairs, licensed by NCC for telecom business. And we have various licenses and certificates to carry out most of the telecom businesses that we are doing, including the digital space that we are in. So that's just brief about Virgin Platform. Virgin Platform now. Okay, please, that should maybe mute his mic. Are we together?
Go ahead. I was trying to
okay.
the order.
So, Virgin Platform International is a company. It's in partnership with Ave Health Sense, which we are now offering. It's called the VIGIT system, which is for you to visualize and then get results. And how does it work? We are saying that the public health practitioners should take advantage of the telecom sector earnings or resources, and they run their businesses. In every society, you take advantage of sectors that are making enough money to take care of all your needs. And then the earning you are getting from that, you run your office or you run your personal bills. There is no argument that bills keep on accumulating every day. Your office bills, including your personal bills, your research and stuff. Now, in the telecom sector, the sector is a ready-made market, especially in Nigeria here with over 200 million members. Active subscribers, about 150 million active subscribers. So every day, so much transaction goes on there in billions. You, as a public health practitioner, you are part of these people that are dropping this income in billions to the telecom sector. But you are just focused on your health sector and you're not taking advantage of the money that is running within this sector. So the VIGIT system is saying you can be part of it. Get yourself into the system, have a wallet shop, run your office with a wallet shop, get the earnings from there, take care of your salaries, your research, and then combine the free call services called Combo Basic from one of our major partners, 9Mobile, and then make your calls for free. With that, you'll be doing your work, you'll be running your office. The money you would have used in expenses for this office, the money is being used to generate more funds or more revenue or more income, as you may put it, to run your office while your money is still intact. We usually say you can eat your cake and have it in my wallet shop. What is my wallet shop? For those that are new, my wallet shop, it's an automatic trading platform that trades virtual top-up. Virtual top-up, we're talking about the VTU that you buy recharge card. For the past, some of you, they asked for the past 1 or 2 years, you have not bought physical recharge card. You've been buying it online from other platforms or from the bank. When you go to the ATM, after withdraw money, ATM asks you to go ahead and do recharge card. And then you are buying this recharge card daily. As we're in the Zoom here, we're already spending money on data. Now, this money you are spending, it is not coming back to you. My wallet shop is saying that you can still spend money on airtime, data, and other things that involve digital space and still get part of this money back by a way of commission. A cash commission comes back to you. Now, you join my wallet shop, you have a shop on my wallet shop, you occupy a space called a wallet. So that wallet, you put your funds there, then the system is automatically trading for you by selling VTU to the community and to the other users. The money that is generating is giving you back 1% weekly, as Dr. Kene was explaining. And that 1%, at the end of the year, you have over 50%, which you will take and take care of your other expenses. Just a matter of saying that, okay, in a year, I spent 500,000 or 1 million for my office as expenses for NEPA bills, for salaries, and then you take this money and then put it in a shop. That money is now generating another income for you to take care of that expense, while your real money that you would have expended them without getting it back is still there intact for you. That's what simply my wallet shop is saying. If you want to run this research, instead of spending this money on research, take that money, open a shop on my wallet shop, put it there. My wallet shop will now generate income for you. You will now use that income that is generating weekly or monthly for you, and then run that research. And at the end of the day, you still have your money back. So it's as good as you use the expense money to generate more money, and then your expense money is still back to you. That's simply what my wallet shop is saying. My wallet shop is a platform that some people come there, they put in money, and then the money is like stock, but that the system used for airtime as a pool. Other people are buying from it, and the commission that, or the discount that the platform gets with its own partners, which are the 4 major telecoms, MTN, Glo, Airtel, and 9 Mobile, is being shared between the people that contribute financially to the platform and those that are buying it. That is simply what goes on there. And we are saying that it does not stop only on earning. You have a research, or you have an office that you spend so much on airtime and call. How do you do? Take advantage of the Combo Basic, which is a CUG service, a kind of CUG service, because this CUG service is completely free. You have the airtime to call all network, but when you're calling within yourself, it is free. So if it's a research and you have people in the villages that are getting you feedback, or you have people in rural areas that are getting you feedback, you deploy this to them. They'll be communicating to the mail office and be giving back the result for free, including the other ones that Dr. Kenneth is going to talk about it. Because the digital, how do you call it? A digital format that gives you back result, or they impute information and you get it back real time in your office. Communication is free using this 9 Mobile Combo Basic service, and then you communicate for free. While my wallet shop that you own is also running and giving you money. Part of this money is what you can take and fund this free call and other things that you are doing in the office. So at the end of the day, VIGIT is just presenting a platform for you that you are not spending anything. You're running the office for free, you're running your research for free, you're running your clinic or whatever you're doing for free, and it's taking care of your expense while your money is still there. And that is where we are. We have encrypted it all, integrated with Flutterwave. So Dr. Kenneth is going to talk more about it, but Flutterwave is one of the people that we integrate. That's why it's a automated system. You don't need to be there. Like me that is talking to you, I'm not in Abuja, I'm in another state, but the system is working irrespective of whether I'm there or not. So when you join the system works for you irrespective of whether you are part of the people that are participating at that moment or not. So thank you. If there is anything that we do not mention, maybe during the question and answer time, we can go ahead and then explain more. Thank you, Dr. Kenneth. You can take over.
All right, thank you, Joshua, for that update on the telecom components of VIGIT system. So what is the project implementation system? So before I go to talk about the project implementation cycle, I want to talk about issues that we face on a daily basis. Just a reminder, there'll be increase in calls. Every day people are calling us, but the salary has not remained the same or little change. The little change in the hazard and hazard allowance is adequate funds for a project. Most times you're running a project and people are telling you that look, funds are not available or funds are inadequate. So how do we maximize and the funds available to us? There's need for monitoring and evaluation. Of course, there's need for supportive supervision. Now with security risks are hard to reach areas, it's becoming more important for us to have these systems. There's Zoom or no call communication allowance. So most of this increase our expenditure without any commensurate increase in our income. So we're trying to maximize this opportunity here. Now, this project is an outcome of the conference communique that was issued at our conference in Ilorin. And the simple idea is that, look, if we are going to ask ministries and states to start digitalizing system, then we should also start taking advantage of that. We cannot just ask them to do things. We should prepare ourselves to showcase what is possible and then demonstrate this to them that this is feasible. So that is why we've been asked to embark on this 6 months pilot project. Now, what is the project assumption? We now know for certain that there's money circulating within the telecom industry. That one is not in doubt on a daily basis. Now, increasing the circulation of telephone funds among public practitioners will improve and enhance the quality of their work. And the simple formula is that technical know-how, technical knowledge and skills minus finance equals to frustration. So if you have everything, you have PhD, you want to do wonderful work, your proposals are good, but there's no funds to back it up. In the middle of it, you will leave the work. And I've seen this happen. Most projects, as they're ending, the projects are collapsing. The systems is collapsing because there's no fund to push through. People have written a lot of sustainability plans. If there's no fund, believe me, you can't sustain any project of any kind. So we are saying that if we now make money available that is now circulating within the telecom industry, then there will be some excitement because whatever project we embark upon, the resources to manage it will be available, or at least we'll have a way of conserving resources and ensuring that our projects are sustainable. So what is the strategic plan? First is to run 4 weeks Zoom meeting for training Wednesday and Sunday. So that is why I'm here. Every Wednesday and Sunday, I ensure that I'm in the office where the solar power energy so that I don't have issues of NEPA or generator distracting us. So we also plan that we should activate 5 wallet shops for each state, for 5 members in each state. So all association members in each state should have evidence that at least 5 members of the state have actually activated my wallet shop. It doesn't matter how much money you are doing, but we are using this opportunity for us to test run and see this for 6 months. If it's something that is worthwhile, then we can now promote it within the entire industry. The third component is to conduct digital tool design training for interested states. For states that are interested, we're going to do this training either virtually or physically, as the case may be. Our team have capacity to do this. Then we also deploy mini audio telehead for selected institutions. Now, people may not understand. With the COMBOPAK basic, you are connecting individuals. And once you connect them, and there's no cost to them at all, then they can communicate with their supervisors. They can have mentoring relationship. They can call colleagues in other places to seek for information. This is what we are capable of deploying with this system. And of course, we'll deploy the complete VIGIT system in the selected state with a dashboard for supervisors to have complete information about this, about what is happening in the field. So the project cycle is 4 weeks of Zoom meetings. So for the whole of May, that is what we're going to have. My wallet shop activation for 5 months, for 5 members per state, starting from May, from May to July, and things like that. Of course, digital design tools will be from May to October. Development mini telecom will be from May to October. Deployment of VIGIT systems selected state will be a continuous process. And of course, the project will be evaluated in November. So it will be open to everybody to evaluate and then critique what we have put on ground. And of course, we'll write a technical report in December and then present at our conference in January in 2020. The whole idea is that there should be a comprehensive understanding of the system by members so that we can critique ourselves and see that whatever we're putting on ground is good. So this is the wallet system that is there. In the back end, we'll be demonstrating that. Now, application of my wallet shop with project management. Now, it's important that we should understand this, that whether we like it or not, there will be bills. So there will be power supply bills monthly. There will be communication bills monthly. There will be fuel bills monthly. There will be office maintenance. There will be pay Zoom. These are necessary project expenditure. What we are saying is that at the end of these 12 months, this money will never return back to you or your system. This expenditure, if these funds are in the bank, they will never return as you're expending them. So what can we do different? We say, calculate this and look at what your needs are. Then once you calculate, you get the system, you estimate all the money need and sum it up. get my wallet shop trading for that value. The trading system happens automatically. So you're not worried about whether you are in the village or whether you are traveling abroad or whatever. The commissions are coming in irrespective of your location. At the end of the 12 months, the project needs are met because you are taking the 1% commission that is coming from trading within the telecom industry and solving the project needs, the needs of the project. Now, at the end of the trading period of 12 months, your funds remain there intact. Remember that the funds are there as airtime, and airtime is being traded on a daily basis, every minute, every hour, and you are getting commission. When the 12 months are over, your funds are now released to you as money, and that money is available back to you. So what we are saying practically here, you're operating at zero overhead costs because the system is giving you the funds that you need. So zero overhead costs. Now, when sustainability is viewed as being a matter of survival for your business, I believe you can create massive change. So for what we're doing, I keep telling people, and I tell opportunity, I say, look, technology does not reverse itself. That time that we will go back and sit in someone's house waiting to make call will never happen again. It will never. The era of Nitel bringing telephone lines to your house will never happen again. So technology is going. The only issue is that most of us are not taking care of and taking advantage of the technology. So the comprehensive VIGIT system talk about monitoring evaluation framework that captures key performance indicators for us to have what we call field-based monitoring. The tools are designed for real-time data capture of key performance indicators. And of course, the COMBOPAK basic system support the closed user group for supporting supervision. Then the estimated cost of operating the system is now powered by my wallet shop. And of course, this system now becomes automatically running, irrespective of which state, irrespective of where it is deployed, is managed automatically, centrally, and gives the result that is desired. So the benefits is getting real-time data. The benefit is getting a system that runs. The benefit is getting a system that helps you with supporting supervision. Now, look at it. The data comes in, clean data. It is monitored 24/7. It's available at all times. So it's simply, how does it work? The deployment of a soft copy tool. So the system works by getting a software tool for monitoring and evaluation. So any checklist at all that you have, be it checklist, be it questionnaire, we can design the digital tool with it overnight. And that is then deployed. So that you can now have real-time data capturing. Depending on the platform you want, it could be COMBOPAK, it could be ODK, it could be any other CAPI system. And now dashboards are created for supervisors to see and monitor what is going on. Now we will now build the closed user group using the COMBO basic system and automate the system at the back end for its financing. And within 12 months, we provide the technical support that you need. So yes, for every project, there are risks associated with projects, and we listed some of these down here. Now, if they change in government policy on the use of virtual top-up, again, we may likely not go back to the paper-based system. Why? The reason is simple. This paper-based system have been justified moving forward to be expensive in terms of operations. So it's very difficult for government to wake up and then say they're not going to do virtual top-up. And if they are going to do that, they will have to deal with the banks, because the banks are the ones that are doing this hugely as a business, and most of them are changing their business model. Alteration of the telecom value chain incentives for VT. This is likely to happen at any point in time, because now during the COVID era, a lot of data use was high, so incentives were easy to be distributed along the value chain of the sector. Telecom policy change on the use of closed user group. Yes, some telecom companies are already saying, look, we are making more money from data rather than voice. So why are we going to invest funds in voice? So if they change policy on that, it will also affect their project. Then of course, limitation of network coverage by telecom. It's not everywhere that you go and have all the coverage, the entire coverage about a particular company. So we need to now look at assessment of areas where those stuff work. Another huge problem that is likely to affect is the rising cost of Android phones and dashboard accessories. Now we know that with the dollar now skyrocketing above 500 now, it's such that each time you want to report anything, the cost goes up. So this will also affect the cost of operations. So where are we going to get all this money? I've said this, we can get money from philanthropists, we can get money from state budget, we can get it from international donors, we can get it from device manufacturers, we can get it from insurance companies. So what is the action for us as public health physicians? Is first and foremost for those of us that are chairmen of states, this is an assignment that we must get done. That 5 public health physicians must, as a matter of policy, subscribe into this system so that they are early adapters and they can test running this and giving us feedback. Then for primary care board to use this audio telehealth monitoring system, this will encouraging our members to start test running and repositioning their states for an era where telecom becomes very critical. If you go out of this country, there's nothing that you do without the telecommunication being involved. And everything is automated. It's only here that we're talking about paper, still talking about paper-based activities. Then, of course, we scale up the model through cycle of influence. And of course, some of our members here who are part of this will share their experiences. And one thing they need to do for us is for us to let them educate people in the various states and ask them to be part of the project. Telecom will never reverse itself, and that I must let you know. I emphasize. So what is the cycle of influence model? Simply get each state's branch to have 5 members sign up into the VIGIT system model. And of course, getting your spouse or any other person close to sign up is optional, but we'll explain that to the team. So we know that as public officials, we know the law of the artificial innovation theory, which comes with 2.5% innovators. So we are innovators, and we're looking forward to you being the early adapters. So the early adapters will critically review what the innovators have put in place, and then we can together move forward to get the early majority so that the systems now circulate funds for us to improve the work we do on a daily basis. This is the project code. The code for the project is 102480. That is why it's called project. Link, our support team will share the chat so that you can sign up. Now, of course, if you're attending this meeting, just write your name in the chat with your email, telephone line, and the state branch you are from, so that we can also have our data. This will share, information will share for us. So in conclusion, I want to say that once social enterprise have a diverse and stable set of income streams, they are better placed to have greater social impact. Yes, states have already joined on the platform. We have Bayelsa, we have Rivers, we have Plateau. We're in discussion with Adamawa State about VIGIT system. We're in discussion with Yobe State. We're looking forward to having other states like Kwara State join us, so we can have these discussions and see how we can pilot the telehealth system. So thank you very much for your time. Behind us, we have the research support team. Stephanie is there to answer your questions 24/7. IT guy, he said it was his birthday, he's there to support us. This is how to reach us. At any point in time, you want to reach us, WhatsApp chat, emails, and things like that. So thank you very much for this. We'll now take questions. If there are comments, you want to make comments, you let us know. After that, we'll do a demo. Demo that we showcase some of these things. So questions? Hello, are we
I'm
there?
still here. Yes, I'm still here.
Questions? Joshua is still here to answer questions. Can we have questions? Professor Melumadu, how are you? Professor Dekule, how are you doing? Any question from you?
My hand is up.
Okay, go ahead, Obaji.
Yes, thank you very much, Dr. Kenneth, for your usual lectures. I think this is the 3rd time I'm joining, and also Mr. Joshua.
Thank you, sir.
I just want to, my own comment is that I joined the platform when we're in the Loring in in March during the PHPN conference, and I've been enjoying joining this. And when I came back, I told my colleagues here in the department about this platform. They were just looking as if it's one of these MMM, and they don't want to. I gave them the flyers. During our seminar, I talked to them. And even this presentation you've been doing since the first week, each time I get the notice, I post it on our APHPM platform there in Cross River State, and I beg them to even join and listen. And nobody has done that. If you check the attendance, we are very few today, none of them from Calabar. And then during the promo April, I managed to register 4 residents, and they just did the registration. None of them even paid for even the minimum of the shop wallet. But I paid when I was in the Lorin, and just last week Friday I upgraded to the next level, which I'm still enjoying. So I don't know, how do we really do this so that our members will be interested? The attendance today to me is very, very poor, and I don't really know what would have been responsible for all the wide publication. So that's my concern. Thank you very much.
Okay, Dr. Baji, first and foremost, I don't want you to worry at all, because even when you do research, you give room for non-responders, isn't it? So that is the first thing. That is the first thing I want you to know. Okay. So, and this exercise, we want you to make it voluntary. Nobody is under compulsion. Now, remember when ATM started? Some people refuse to even get ATM card because they have not seen the machine before. Now everybody is doing using ATM card. When online payment started, people were like, no, I can't use my card online. Now people are using the payment online. So the whole idea, our job is to provide information. We are not by any compulsion forcing anybody. Now, some of the people with us here who even want to share their experience, it was not that they felt this thing was doing. Me that you are seeing me into this. If I tell you my story in the digital system, you'll be amazed. I never from day one planned that I will be doing things in the digital world. When I got employed as a senior medical advisor, documentation and public evaluation at FHI, they were developing a software called LAMIS. I was just coming from my training as a consultant. I just got my result. Now, the thing that happened that was surprising, that why I was doing housemanship, I took a diploma in computer science. I never knew this was going to be useful. So when I now resume work, what happened? The country director said, oh, there's someone with a background here. Come and follow the IT team and start developing software now that is being used publicly. My guy, I used to close late from work. I was frustrated. I have my knowledge. Why are you wasting my time to be talking about software development? And that was the beginning. I never knew that it was something that later years will now become useful. Now you see me committed to public, to the association. Yes, in 2015, then it was under the leadership of Professor Kande. They nominated me to go to New Orleans to go and represent the association at the American Public Conference. At that conference, same story. I was co-opted into use of social media advertisement. For 3 weeks, for 3 days, I was in the social media lab being trained on how to apply social media in public health. Now, when I came back, who was doing Facebook before? Nobody. I came back and apart from writing the report, I presented at the conference in Benue on how to use Facebook advertisement for public health. And today you will see WHO using Facebook advertisement. UNICEF is using that. A lot of that has been used. So the issue around this is, it's an area that is great. Nobody can tell you for sure that, oh, he's setting with this. That is acceptable. But who will learn? So it's not for us to say, oh, I'm frustrated talking to people. No, engage them and let them know. Whether they like it or not, who was using Zoom before? Who was using Zoom? You understand the point? Now, yes, sir. Most of us that even did training in public health, at a point, who was using the computer? Everybody was doing tally. You come to use computer and say, no, you can't do this. Today, everybody is using it. So for me, there's always innovators, and we are positioning ourselves to be innovators. And there's always early adapters. The only thing that will make us have problems is when we are forcing people to do things. No, we are early adapters. Let's do what we can do. Provide the evidence. Our job as researchers is to provide evidence. And that is why we are piloting this project. And one of the evidence you are simply telling me is that your state have refused to be part of the webinars. Who will document it? That after 4 weeks, we didn't see participation from these states. Who will document it? But by the end of 6 months, we also document everything that's happened. And remember, we are presenting at the next conference. So some of the people you are telling you now that, oh, they may not do it, they may not do that. Nobody should be compelled to do anything. It's voluntary, and it has to happen that way. And of course, as we share our experience, we expand this thing. Thank you very much.
I'm grateful.
And in addition, hello, Mr. Watt.
Go ahead.
Yes, I'm hearing.
Yes, and in addition, just like Kenneth stated in the presentation, you have early adopters, people that when they see something, they believe in it, they adopt it, and you have some people that will certainly stand by, watch before they will come. I have so much experience on this issue of my wallet shop that if I start sharing with you, it'll be funny. We went to Akwanga, just one of it, we went to Akwanga to Dr. Kenneth's 50th birthday. Before they could call us to come and give presentation, almost the whole hall was empty. People remaining were just about 10 or less. Some of the staff who went with me, like, we should just forget about this. I said, let's go ahead and do our presentation. To cut a long story short, in that presentation that we did, I mean, in that, how do you call it, that Akwanga that we did a presentation that we had less than, in fact, the people remaining were mostly people on the panel. The rest of the crowd left because people were presenting and they were leaving because people didn't know us. So they were called almost the last people that were called. But that Akwanga gave my wallet shop, generated revenue of my wallet shop, not less than 50 million naira. I'm sure Dr. Kenneth is hearing that for the first time too. That was his 50th birthday. Now, you have some people that we have about 2,600 people. Some people are indirectly part of this Zoom. You will not know. After the Zoom, they will ask other people, how was the Zoom meeting? The response they get from those people, it's enough for them to come on board later or to even sign up without telling you. But you may think they are not part of this Zoom. If you call my customer service people, you ask them, you discover that a lot of people come up, they ask, they say, I'm Dr. This, I'm Dr. This. I did not attend your Zoom, but someone told me what happened in the Zoom, so I decided to sign up. So funny enough, you may not see people here, but if you do anything wrong here, you'll be surprised that before you finish this Zoom, somebody will call you and tell you that I heard what happened at the Zoom meeting, even though it's not part of it. So it's the same way people are observing. So to me, I'm happy with your concern, but that shouldn't be a major concern. Even if it is 3 people in the meeting, whether it's the same people, no problem. It may surprise you that after some time, those people you are talking about in Calabar, most of them, they may become members of my wallet shop without you even knowing. So that is, it's a good concern, but it shouldn't be a worry. Thank you so much. I don't know whether that has helped.
Very much. I'm encouraged. Thank you.
Yeah.
We're doing our job. So, Dr. Yakubu, are you still there?
Yes, I'm with you live and direct.
Okay, so we are going to do a demo. Will you hand it over there or I should go ahead?
Please go ahead.
Okay, fine. So who else is here for, I don't think there are new people here except for Anthony Friday iPhone. Otherwise, every other person I'm seeing here, I'm aware of what they are doing. Otherwise, I would have said I would do a demo. So, Anthony, you can drop your telephone number in the chat box and the network. I'll now see how I can buy airtime on that platform. Let me just share my screen and show how this works. I think that is the only person that, so if there's a phone number, I can pick it up. If there's any, okay, so this is how it works. I'm just opening up my browser. So this is the platform. So essentially, this is the portal. This is the portal. The portal is like this. And the portal explains most of what we shared in the presentation. So if you can look at this, this is actually the available shops, 1% of each per week. So if it's 25,000, this is what you get. And if it's 1 million, this is what you get. 1% of 1 million is actually 10,000. So if your cost of operation is estimated to be 50,000, it means 50,000 times 12, that is about 600,000 per year. You need a shop of 1 million that will be generating 10,000 per week, which is 520,000 to address your overhead cost. Is there any number here? Okay, so okay, fine. Okay, you had a session before. I'm expecting a new person who can get airtime, but that's fine. So today I will use my personal shop. I will use the project shop. So I'll use my personal shop. So I'm going to sign up in now. So this is my shop. So this shop trades with a cycle of 7 days on Saturday. So every Saturday we get the commission. So this is my shop. This is my personal shop. I'm signing, and it's trading at this value. You can see I will have this amount in voucher wallet. Now I told you each time you buy airtime from the bank gets 2% of that commission. So we're going to try it here. So look at the commissions I have here. This is the largest here is actually 10. So I'll now buy airtime of 500 for the number there. I have which number is there? Okay, so Obaji's number is there. So I'm going to buy airtime. Click on airtime and click on buy airtime. So I will now put the number there. That is his number. Ensure that there's no space. If there's space, there's a problem. Usually do not pick it up. So that is his number. I'm going to pick MTN, which is his network, and I'm going to buy airtime for 500. Now, 10%, 2% of 500 is actually 10 naira. So after the purchase, he will have airtime on his phone anywhere he is, whether it's in this country or outside the country. He will get the airtime, and then of course 2% of that value will equally be added to my commission wallet. So yes, in the next 30 seconds, his phone should be loaded with that. So when we say we're providing backend, of course, when we're providing backend, say 500 have been deducted from here, and I've got 2% of 500 is 10 naira. We now have 10 naira added here. When we say that we are going to provide 24-hour automated system, yes. So if we are setting up your CUG system, the system we founded from the central pool as coming from the resources here. So essentially that is where it's happening, and that is how it's happening. Have you gotten the airtime? If you've gotten the airtime, let us know.
We are not seeing it very well, Dr. Kene.
Have you gotten it?
I've not gotten it, I'm not seeing.
Okay. So if there are questions, let's have them. Okay, recharge of 500 received. This is it. He has just shown that recharge of 500 have been received in the chat. So essentially that is it. If there are questions, we can take. Otherwise, we'll move on and do the work. So our work as members here essentially is education. Get the states. If they want personal presentation by our team, they can book us. Even if they want us to do in the daytime, we should be able to do that. And at any point in time. So next week, we'll have another guest speaker coming to be part of this presentation. Thank you very much, everyone. If there are comments or questions, you let us know. Oyefabi, you want to talk to us?
Thanks for this constant education on this VIGIT system. I think it's getting clearer every day. Thanks for your consistency. So as you have said, we will try as much as possible to get our members registered from Kaduna State. I'm already on the platform. I can testify that the thing is working. and I hope to increase my investment by the time the current one I'm using expires. So it's a good one, sir. More grace, sir.
Thank you very much. Dr.
Hello,
Lam?
Dr. Kenneth.
Hey, Onyes.
Hey, I'm seeing from Makodi.
Oh my God, how are you doing? Nice, madam.
Fine. In fact, I had to rush to make sure that I join this conversation, discussion this night.
Okay.
It's been so exciting, and I joined halfway, and I have enjoyed something. What I've enjoyed, because I have not been able to increase my savings, at least the recharge aspect of recharge cards, I've been enjoying that. And I think from this presentation now, I think I have to update myself.
Okay, thank you.
Hello. And I promise you that I will try as much as I can to make sure that I carry along the good people of Benin State.
Okay.
Prof. Audu, I agree to your answer me now, Prof.
Thank you very much.
Ogalan, well done so much. Well done, sir. Well done, sir. And
Audu.
Thank you, sir. I remain lawyer, sir. I remain lawyer.
Prof. Audu, if I'm increasing you. And the
I remain lawyer. Thank you, sir. Thank you, sir.
So, Dr. Lan, you want to say anything so that Yakubu can close us?
Okay, okay. So, thank you so much, Dr. Kene. I must thank you for showing us how this works and your consistency. I'm a testifier that I want to testify that this is working and is very, very cost-saving for me. It has helped me in so many ways. So I just want to say that it's a way of really saving costs in these times of economic breakdown. And I've not bought recharge cards since I joined this since September last year. And I've been dashing people recharge cards every now and then. I'm just happy with this. I want to thank you so much for being so consistent and being such a great friend, really, and a great colleague who has been out there to help us understand the system and also to actively participate. I want to just encourage Prof. Audu to increase his investments, and also I've told all the friends, all my close friends, I've told them that this is something that they should quickly come on board and be part of, because it's very real. I want to also say that I spoke with Joshua, the CEO of Vision, the platform. I spoke with him one-on-one. I was asking him, how do you make these commissions that you are able to generously share with shop owners? And I was convinced, because his data is airtime, and now we're moving to TV subscriptions and all of that. So it's something that has come at the right time, and I want to encourage everyone to come on board. Thank you so much, Kene, for the time and also for your doggedness, trying to share the good news. Thank you so much. God bless you, and God bless
thank you, Lan. Thank you very much, Dr. Lan. So before we close, Joshua takes another 1 minute to talk about, to throw more light on the products and how it works. Lan was just talking about your communication with him and how the trading happens, or how you sharing the commission. It's just because the banking system have not choose to share. Otherwise, what happened on a daily basis in the telecom industry is huge. Joshua, are you still there?
Yes.
Okay, so just 1 minute before Yakubu closes us.
Okay, how the system works, Abi?
Yes, just 1 minute.
Okay, now in a minute, the system works by providing VTU to users. And because we are major partners to these 4 telecom service providers, you buy airtime. If you buy airtime 1,000, they give you the value of 1,000, but to us as Virgin platform, it's not 1,000 they give to us, they give us at a discount. So assuming the discount given to us is 4% or 3%, we are simply saying that when you buy airtime of 1,000 naira, The 3% that is given to us, the system is simply splitting the commission into two. It's giving you 2% to 1% and dropping the other one with the platform. So that is how the money is being generated. That's just all about my wallet shop. Just to put the money in funds, you buy, because we have a partnership, we have a discount, and that discount it's automated to be shared between us and the users. Before I close, I want to say something about one man. It's not part of the public physician, but I have a senior friend in the office. If you know this man is very, very critical before he does anything. In fact, we did not take time to preach to him about my wallet shop because he knows me and he knows what I'm doing because we share the same office. So I decided to just tell him brief and left. It took this man almost 1 year to study my wallet shop, to study everything before he decided one day that he was going to do it. As I'm talking to you now, he called me this week and said that his school fees of his children, because the children are in private school, and the rest is close to 1 million per term. It is my wallet shop that has been sponsoring that since he joined my wallet shop. So he has been using my wallet shop. Instead of paying the school fees to the children, he opened shop with these school fees, and the school fees is generating another school fees that he pays the school fees of his children. I don't know whether that sounds complex, but the school fees that he would have given to the school, he used it to open shop, and he's taking care, he's generating income and paying the children's school fees. That's how my wallet shop is. That money that you have, that you put it as airtime on the platform, the money is being sold to other people as airtime, and whatsoever discount the system is generating is shared between us and you that bring this money. Because it's not everybody that has a shop, so few people that have the shop are the one that go with this 1%. So we encourage people. We are working on more partnership with other big organizations. We know that Dr. Albert was saying, that Albert also he was saying, the day we announced our partnership, I'm sure a lot of people will rush in. Many people came here and could not get institution wallet now because it's closed, but they were dragging feet when it was open. By the time a major partnership is announced and people start rushing, as when people had about Flutterwave and a lot of people started coming, I want to be part of this system, you may discover that these shops that you are begging people now to own the shops, they will be the one begging that, please, can I get just more shop, even one shop, to be part of my wallet shop? That is where we are heading. We are heading, God helping us. Thank you so much for always giving us time to give you this offer and to serve you better. Thank you, Dr. Kate. Can I take up from there?
Thank you, Joshua. That is fine. We are moving on. So, Dr. Yakubu, we should round up now. Dr. Yakubu.
Yes, sorry, I was just trying to put my camera on, but it seems with the camera. To thank each and every one of you.
Sorry.
And Yakubu, all the people.
Salahuddin has a hand here. Salahuddin.
Okay.
Salahuddin, can you say 1 minute, please? Salahuddin.
Good evening, my colleague.
Okay. Professor
Yeah, good
Salahuddin,
evening.
welcome.
Yes, I'm a new timer.
Good evening, Gas. Good evening, Professor Gas.
I remain loyal, sir. How are the good people of Benue State? Yes, I'm a new timer and I'm just acclimatizing. But at least I can say that for recharge cards, paying for DSTV, I think is fantastic. What really annoyed me most, why I decided to join, was that, when you buy airtime nowadays, they will charge you. And in the midnight, I will now see another alert via my email. They are charging me 6 naira 28 kobo. Before midnight again, another 6 naira 28 kobo. I was now wondering, can I mention this thing? Why am I wasting my time? Let me shift base. So that is why I can advise anybody on the platform. If you have not joined, please, it's very, very important. Go and join. It's interesting, and I'm getting used to it, and it's quite good. So I want to encourage colleagues to join and encourage others to join also. Thank you very much.
Okay, thank you, Salahuddin. Salahuddin is one of the people that joined during after the conference in Ilorin, even before we started the implementation of the project. So Yakubu, over to you.
Sure. So thank you very much. It's 12 minutes past the hour, so we really want to appreciate all of you for your time and patience. In closing, we will not take much of your time. I'm one of the early adopters. I think mine dates back to 20 months ago, and just as people have said, I don't want to repeat what they've said, but I think it's something that you will not regret when you join. Um, and all the people, the CEO and Dr. Kene, I have known them personally. And I want to tell you that the platform is really working, and I encourage each and every one of you to preach about the platform. But most importantly, it's look at the cost, of what you do and what also Ave Health Sense does. In addition to the platform, Ave Health Sense, it's a one-stop shop that can actually help you with your project or your proposals. Um, they can provide you proposals, they can support your proposal write-up, they can help you with monitoring and evaluation, they can help you with your data capturing tool in electronic formats. They can also help you with your analysis of your report. So I think it's important, in addition to the digital platform, to also look at the other aspects, the value added or the value addition that Ave Sense has brought on board to the VIGIT system. So thank you very much, and I want to wish you a very successful week to go into Monday. I declare this meeting closed at this point, and good night to everybody. Thank you. Bye.
Thank you. Good night,
All right.
everybody.
Thank you, Dr. Yakubu.
Good night.
Okay. Thank you,
Good
everyone.
night.
Good
Dr.
night.
Yakubu, good night. Karen, good night.
Okay.
Hey, Dr. Lan,
Bye.
good night.
Bye-bye.
Aheruna.
Ebu Joshua, good night.
Thank you very
Jim
much.
Audu.
Oyems.
Yeah, very good night, everybody.
Professor Audu.
Oyems.
Yes, he's
Dr.
there.
Oba, thank you for always coming.
Yes.
Anthony,
Oyems, I've not heard
everybody.
your voice.
Anthony,
Dr.
night,
finally,
Dr.
thank you.
Kenneth.
Prof. Audu, you never call us to go.
Dr. Lan and Dr. Adamu, it's quite some time.
Yes, so Oyems, it's been a long time we've not met. We need to catch up.
I don't know. Why have you decided to leave me like that behind?
I beg.
Oh, no,
You know, they
Yakubu,
said
this time you are calling